press conference has been organized again to outline the ministry's response in combating the spread of MenC in Fiji, and of course to provide you an update on the procurement of the vaccination for MenC infection and the mass vaccination rollout program. Situational report as of today, we can confirm that there are a total of 58 cases reported from January 1st to April 22nd. Of these, 24 are laboratory confirmed and 34 are either suspected or probable cases based on clinical diagnosis by doctors. Of the 58 cases, 38 cases have been from the Central Division, 17 from the Western Division, 2 from the North and 1 from the Eastern Division. Males account for 66.7% of the cases recorded, and females 33.3% as of April 22nd. All confirmed cases were below 19 years of age. There have been 4 confirmed deaths from meningococcal diseases this year. All these deaths have been in the age group less than 5 years. There have been no deaths recorded from meningococcal diseases in the last 5 weeks since the outbreak was declared. And at this point, I'd like to thank the general public for adhering to the preventative messages that the ministry has been putting out through mass media advertising and awareness campaigns. Indeed, with no deaths recorded from within the last 5 weeks, it shows that the general public has been very responsive to the awareness messages conveyed through various communication channels, and I'd like to thank you all for that, for being part of our ministry's awareness program. Thank you very much. Ladies and gentlemen, on that note, I'd also like to express my sincere gratitude and appreciation to the task force, the National Meningococcal Task Force, whose members include the Pediatrics, Internal Medicine, Intensive Care Unit, Pathology, Emergency Medicine Consultants and Heads of Department, Infection Prevention Control Officers, Medical Superintendents of our divisional hospitals, the Deputy Secretary of Public Health, Divisional Medical Officers, the National Advisor Family Health, National Advisor Environment Health, National Advisor Communicable Diseases, the Acting Director of Fiji Pharmaceuticals and Biomed Services, representatives from the School of Public Health at the Fijian National University College of Medicine, Nursing and Health Sciences, the Pacific Community, the Fiji Program Support Facility and the World Health Organization, of course, including the Fiji General College of Practitioners, who have also sent representatives to our task force meetings. Ladies and gentlemen, in addition to the task force, the Vaccine Preventable Disease Committee led by the National Advisor Family Health, including the National Expanded Program for Immunizations Coordinator and Divisional Directors of Nursing, have also spearheaded planning and procurement of the vaccine through consultations with UNICEF. I'd also like to say a big thank you to UNICEF. Furthermore, the World Health Organization's office in the South Pacific, based in Suva, has been a key member of the task force from the very beginning. And through WHO, we have had the opportunity to consult via teleconferences with health authorities in other countries that have been through similar outbreaks, as well as other international health organizations. We'd also like to thank the FET for the tremendous assistance given during the consultation process during this outbreak. The ministry continues to intensify its public health awareness and closely monitors the reported cases. We have also capitalized on the targeted awareness opportunities through last week's Coca-Cola Games as well, during which our team was also involved in the promotion of public health measures and awareness. Our zone nurses, our health inspectors were also available at the game site, providing education and information material to participants. And I've been told that was a very, very successful campaign with a lot of students coming forward asking for advice and awareness materials. Ladies and gentlemen, similarly this week we have teams at the Divisional Youth and Sports Conference held at Lalin Memorial High School, again to raise awareness on combating the spread of this MenC. The appropriate antibiotics are available in all our divisions and subdivisions, and any suspected case are being referred to the divisional hospitals. Now to the main part, how are we going to roll out the national mass immunization campaign? Like we've said, it's going to be between ages 1 and 19, and that's why we are giving it a title, mass immunization. In terms of our further progress plans, as we said in Parliament, we are committed to the rollout of national mass immunization campaign, and this will include about 333,876 individuals between the ages of 1 and 19. The vaccination program will of course target MenC because this is the type of bacteria that is causing this outbreak. The decision by the Ministry of Health to roll out the mass vaccination to 1 and 19-year-olds has been based on our consultations, extensive review of the evidence on international best practices for response to outbreaks of MenC disease. And of course, there are three objectives of this vaccination program. One, we want to protect those who are most at the risk of this disease, and these are children under the age of 5 and teenagers. We want to protect those most at risk of dying from the disease, again, children under the age of 5. And reducing spread of disease by lowering the amount of people in the community that carry the bacteria, causing what is known as the herd immunity. The latest case information shows that the vast majority of cases recorded this year have been in the under 19 age group, with close to 40% under age 5. All the deaths this year have been in the under 5 age group. Thus, individuals under 19 years old are also most at risk for getting the disease as they need to be protected. They are also known to be the biggest age group that spread the bacteria. And of course, you and I both know for behavioral reasons. Vaccinating the 1 to 19-year age group against MenC has been shown in other countries, for example Australia, to greatly reduce the cases of MenC in all age groups, and most importantly in our babies. The rollout since the outbreak declaration on March 20th, 2018, the task force has been working tirelessly to secure the procurement of the MenC vaccine. Within a month, through its prompt response, the ministry was able to secure confirmation from the International Coordinating Group for Vaccine Provision for Epidemic Meningitis Control, we know it's ICG, that we would have access to the vaccines required to vaccinate everyone from the ages 1 to 19 years during this outbreak. Upon confirmation received on April 20th, 2018, we are expecting the first batch of vaccines to arrive tomorrow, 4th May 2018. Obviously, there was no delay. I was fascinated with reading some of your articles. We never gave a time frame, so obviously there was no delay. We are well within our time frame. Okay? So, yeah, there's all those things there. So, what can I say? Procuring the vaccination, ladies and gentlemen, it's been a very, very intensive process. And of course, complicated by the fact that access to this vaccine stockpile is usually prioritized for outbreaks of meningococcal disease in the African meningitis belt, and for low-income countries based on the gross national income per capita, which Fiji does not qualify for. However, the team made every effort in our powers to ensure that our application to have access to those vaccines in the international stockpile was successful, and we did make a promise to vaccinate everyone from age 1 to 19 in Parliament, and we are going to fulfill that. So again, if I may reiterate, there was no delay in getting our vaccines, and we are on time. Since the rollout of the immunization campaign is now planned to begin on 14th May 2018. In addition to this procurement process, supplies of MenC vaccine, it's very important to note, are limited on the world market. And it would have been extremely difficult and much costlier to procure this massive amount of vaccine by any other means. Ladies and gentlemen, the conjugate monovalent MenC vaccine is safe and effective. It has been licensed for use in countries like Canada, United Kingdom, and Australia since the late 1990s. The rollout of the immunization campaign will commence within days of the arrival of the vaccine. Initially, we'll roll it out in the central and Ra subdivision in the west. It will continue until all the individuals within the target age group across Fiji have received their vaccination. Children attending schools will be vaccinated at the primary and secondary schools as well as kindergartens. Those children who might miss the vaccination at schools are required to go to the nearest health facility, which will be having a dedicated team to provide this vaccination. So we are encouraging every parent, every guardian and the communities at large to make good use of this opportunity. Of course, you can be a politician's child, you can be a businessman's child, you can be a millionaire's child. You all will get the vaccination if you fall within our targeted group. Okay. As for individuals at tertiary level, working or staying home and are well within the targeted age group, can get vaccinated at the nearest health facility as well. And we will continue to provide more information on the vaccination rollout through many more media advertisements and awareness campaigns. Ladies and gentlemen, meanwhile, we have emphasized earlier that vaccination is just one part of the strategy to combat this outbreak. The other component of the prevention strategies have continued throughout the outbreak, that is enhanced surveillance and early case detection, early treatment, contact tracing and prevention through community awareness. We continue to reiterate and we continue to say that the public plays an important and a very crucial role through recognizing possible early symptoms and going early to our health facilities to be checked, and of course by employing basic hygiene, hand washing practices, simple things like when you cough, use a handkerchief, not sharing drinking cup, glasses, bottle, and of course these things could lead to the prevent of the spread of this bacteria. So there we go, update on MenC. I think it's good news. We'll be able to roll out our vaccination program very soon and shortly. I'm happy and I'm sure this news will be taken very joyfully by the members of public. Again, we appeal to the public while we continue with the vaccination program. Prevention is always better. So just a quick update on dengue. I'm sure you'd be asking me questions about what's happening to dengue. We have not forgotten about dengue because of this MenC. Dengue is and has always been on our radar. So just a short brief on dengue. We so far have 3,197 confirmed dengue cases recorded. Of course, there's a downward trend in all divisions. The breakdown of cases by divisions: Northern recorded 1,443, Western with 908 confirmed cases, Central with 825, and Eastern at 21 cases recorded. Again, we'd like to thank the general public for their continued support in our efforts to combat dengue. Like I said, they play a very important role in combating any of these outbreaks. And we'd like to encourage all members of the public communities to continue to practice preventive measures to prevent themselves and their families from these communicable diseases. And again, if I may stress, everybody is responsible for their own health. Ladies and gentlemen, if I can make a short concluding remark, coming back to you, the media, our partners, in taking our message to the public in a very responsible and very sensitive manner. So those are the facts that we've given to you, and I can only ask that we deal with this issue in a very responsible and a very effective and a very sensitive manner. And the facts that I've presented to you is the reality, and this has been done in consultation with our international experts who have helped us craft the most effective response strategy possible for our people. As of tomorrow, we are going to have the vaccines in our hand, and we will begin the nationwide vaccination to combat further spread of MenC in Fiji. It has really been very unfortunate to see a lot of players coming on board and giving their comments, and of course, whatever the agenda be, a lot of people have tried to seize on this issue for political gains, and if I may say, personal gains, by making very deep, irresponsible and unsubstantiated commentary. In my view, this has caused public confusion and created misplaced anxiety and fear among our people on this very important issue that pertains to public health and well-being. At every stage, ladies and gentlemen, of our management of this issue, we have been very clear and transparent, and we have provided critical information that has helped actually protect our people from the spread of this disease. That is what we are focused on, and I suggest that members of the other political parties focus on the same. We all owe it to our people to only speak the truth, because when it comes to public health, I think it's the truth that only saves life. The ministry has reached out to a lot of media organizations, and we've sought your support in providing and protecting the people of Fiji through truthful, accurate, and scientifically valid information on vaccines and vaccination. That's very important. These vaccines are not something that I can go and get from a market. I cannot just get it off a shelf. Okay, so that's very important. We need to be really, really clear about what we are getting for our people, and so that's basically it. It is essential that communities maintain their confidence and trust in the vaccination program as a whole, because it is safe and it will be very effective in combating the spread of MNC. We've had leaders talking about delays, we have leaders talking about a lot of issues, but I suggest that people who are vying to lead the country get their facts right. There are systems, there are processes involved when we try to procure, and when we procure this vaccination on a mass scale, believe me, ladies and gentlemen, it becomes a very, very complicated process. And we have to follow our processes and systems of procuring any drugs for the betterment of our people. So I guess what we need to do when it comes to the health of our people, let's all work together. Okay? Let's all get together. Let's leave our politics aside. And let's spend more time to ensure that our people get the right information, information on a timely basis. And I ask you as members of the media to please be responsible in reporting these issues. Okay? Be responsible in raising awareness on the importance and the safety of our vaccines. Okay? Every minute that people spend reading false information, that will be a minute lost in making a right choice. Okay. So again, like I said, this is not the time for politics, lies, or getting sensitive news to our people. Our people deserve much better, and I think you are the best people to take the right, accurate information down to the people. At the ministry, we are going to keep doing our job to help protect the Fijians from the spread of diseases, not only like MNC, dengue, lepto, all these cases that are coming up. I will not be deterred by political texts that attempt to undermine my work or the work of my team here and the work of our international partners, because we are here to serve the interest of all Fijians at all times. And that is our mission, and that will remain our missions.